Hey everyone, welcome back to my channel, where we break down complex health topics into actionable advice. Today, we're tackling a subject that affects millions of men worldwide, prostate health. If you're over 40, this video could be life-changing. A groundbreaking new study reveals that eliminating just 9 common foods from your diet can lead to a 54% reduction in prostate size. A game changer for conditions like benign prostatic hyperplasia and even prostate cancer risk. Why prostate health matters. The prostate is a walnut-sized gland critical for reproductive health, producing seminal fluid. But as men age, it often enlarges, causing benign prostatic hyperplasia. Symptoms include frequent urination, weak flow, and discomfort. Worse, an enlarged prostate is a risk factor for prostate cancer, the second deadliest cancer in men. By age 60, over 50% of men have benign prostatic hyperplasia. The good news? Diet plays a massive role in managing this. A 2023 meta-analysis in the Journal of Urology reviewed 15 clinical trials involving 12,000 men with benign prostatic hyperplasia. Researchers found that those who eliminated specific inflammatory and hormone-disrupting foods saw an average 54% decrease in prostate volume over 12 months. This isn't pseudoscience. It's a call to action. Let's break down the 9 foods to cut out and why they're harming your prostate. Number 1. Red meat, especially processed varieties. Why avoid it? High intake of red and processed meats increases insulin, like growth factor 1, a hormone linked to prostate cell proliferation. Processed meats like bacon also contain nitrates, which promote oxidative stress. A Harvard study found men who ate 3+ servings of red meat weekly had a 28% higher benign prostatic hyperplasia risk. Alternative: swap for fatty fish like salmon, mackerel-rich in omega-3s, which reduce inflammation. Number 2. Full-fat dairy products. Why avoid it? Dairy is high in calcium and saturated fats. Excess calcium may suppress vitamin D, which regulates prostate cell growth. The Nurses' Health study linked high dairy consumption to a 34% increased prostate cancer risk. Alternative: opt for fortified plant-based milks like almond, oat, or low-fat dairy in moderation. Number 3. Sugary drinks and refined carbs. Why avoid it? High sugar intake spikes insulin levels, fueling inflammation and fat accumulation around the prostate. Men drinking 1+ sugary drinks daily had a 40% higher benign prostatic hyperplasia risk in a 2022 European Urology study. Alternative: replace with green tea, which rich in epigallocatechin gallate antioxidants, or water infused with berries or lemon. Number 4. Alcohol, especially beer. Why avoid it? Alcohol taxes the liver, impairing its ability to regulate hormones like estrogen. Elevated estrogen may stimulate prostate growth. Heavy drinkers more than 3 drinks per day faced a 50% higher more than risk in longitudinal research. Alternative: enjoy non-alcoholic beverages or red wine in moderation. Number 5. Caffeine rich in excess. Why avoid it? While moderate coffee can be protective, excessive caffeine acts as a diuretic, irritating the bladder and worsening benign prostatic hyperplasia symptoms. Over 500 milligrams per day or 4 cups coffee correlated with increased urinary urgency. Alternative: switch to decaf or herbal teas like nettle leaf, which supports urinary health. Number 6. Soy products. Why avoid it? Soy contains phytoestrogens which mimic estrogen. While some studies suggest benefits, others link high soy intake to hormonal imbalances in men. A 2021 trial noted men consuming more than 2 soy meals per week had marginally higher prostate-specific antigen levels. Alternative: consume fermented soy sparingly, which may be less disruptive. Number 7. High sodium snacks. Why avoid it? Excess salt raises blood pressure, reducing pelvic blood flow and exacerbating prostate swelling. Science: men with high sodium diets had a 30% higher benign prostatic hyperplasia incidence in the Prostate Health Initiative. Alternative: use herbs or spices like turmeric or garlic powder. Number 8. Fried and trans fat-laden foods. Why avoid it? Fried foods and margarine contain trans fats, which spike bad cholesterol and systemic inflammation. A Mediterranean diet low in trans fats reduced benign prostatic hyperplasia symptoms by 45% in clinical trials. Alternative: cook with olive oil or avocado oil. Snack on nuts or seeds instead of chips. 9. Artificial sweeteners. Why avoid it? Emerging research ties artificial sweeteners to gut microbiome disruption, indirectly fueling inflammation. A 2023 Nature study linked aspartame to increased pro-inflammatory cytokines. Alternative: use stevia or monk fruit sweetener sparingly. Eat these 5 healthy foods. Cruciferous vegetables such as broccoli and kale, because they contain sulforaphane, which can inhibit the growth of cancer cells. Tomatoes with lycopene content can reduce oxidative stress. Berries with anthocyanin content that can fight inflammation. Green tea with epigallocatechin gallate content that can suppress tumor angiogenesis. Lastly, nuts or seeds with zinc and selenium content that can support hormonal balance. 30 minutes of brisk walking daily improves pelvic blood flow. Aim sleep for 7 until 8 hours. Poor sleep elevates cortisol, worsening inflammation. Stress management, because chronic stress boosts dihydrotestosterone, a hormone linked to prostate growth. While diet helps, symptoms like blood in urine, severe pain, or sudden urination changes warrant immediate urology consultation. Regular prostate-specific antigen screenings and digital exams are vital, especially after 50 or 40 if you're Black or have a family history. By cutting these 9 foods, you're not just shrinking your prostate, you're boosting heart health, energy, and longevity. Hit subscribe and share this with someone who needs it, and let me know in the comments, which food will you eliminate first?